he had one on next to the boat, but he lost it. So.
Look at it.
Yeah, I was right next to him when he had followed her on the 8 3 times and then hit it on the third round. So it was pretty cool. Did not get it in the boat, unfortunately. It was good. Definitely is.
It'll grow up to be bigger.
Do you have extra paper?
I do. Then, yes.
Please, sir. I didn't know if you had any sheets.
I've got something around here.
What do we need?
Just some paper.
I forgot to bring them.
I've got, yep.
Like recording this, you can, go back through and rewatch part of
Yep. Oh, the old AccuCheck. Blood sugar. I just want to make sure that I haven't done a live stream in 9 months.
Thank
So you're welcome. I'm going to check. Make sure this is working.
Is the boss at home watching so she can let you know?
Yeah, no, probably not.
So she can let you know if it's all working good?
Stream. Let's see what we got. That's the wrong stream. Oh, live. I'm going to check. It's working. Make sure this is working.
Is the boss at home watching so she can...
It's working.
Yeah?
Yep. All right. Good. I feel like I should be sitting down. We have such a small group. Maybe
You want me to grab a chair?
I'm going to grab a chair. Otherwise, I feel like I'm preaching to the audience here. It'll be a little more informal anyways with the smaller group. Yeah. How's that? And I can rest because I've been standing all day anyways as a pharmacist. So, all right. We're all doing good? You look familiar. So that's your husband?
Yeah.
Yes.
Yeah. Your name?
Ron.
Ron, good to meet you.
Butch.
Butch?
Linda.
Linda?
Sally.
Sally?
Karen.
Karen. Excellent. I hope you two look familiar. So this new face, but I'm Dan. So I've been here for almost 22 years now. Started here in 2010 and just pharmacy background wise, traditional pharmacy, all that kind of thing. Worked for Walgreens for a few years, realized like that was not my cup of tea at all. But they're good at what they do. I feel that we're good at what we do. And what we try to do here is restore physiology, get the body working the way that it was intended to work, right? So that's my focus. And I think this pharmacy does a good job of that. It does. I mean, the reality is a lot of patients are on medications and they're trying to figure out how to get off those medications. And we all know this, they're really powerful drugs and they can be. And so we don't just want to cold turkey stop them and then we can get into more trouble and so forth. We were just talking about acid reflux and PPIs and those types of drugs, which are horrendous and you can get physically addicted to those. I was on those for 2 years. And that's kind of what led me to really looking at functional medicine and really like going back to the physiology book of like, well, how does the body work and why do we need all these medications in the first place? So I think with Detox and what Brock's going to talk about is we've got so much toxic material in our environment that we probably don't even know of. And even like the flame retardant carpet and the stain resistant materials and sprays that are put on everything, they're everywhere. And so it's really, in my opinion, doing all the research for tonight's talk, it's impossible to avoid all of these toxins. So
Well, disheartening. The more you learn about it, the more it's like all over.
it's everywhere. It's the no wrinkle shirt that you're wearing because, well, why does it not wrinkle? It's cotton, and it's like, well, what's sprayed on it? That's a problem, right? So we started looking at those things, and it's like, I got to stop digging around too far because then you're like, yeah, you can't live in a bubble. So about things that we can do, like getting clean water, clean air. If you don't have a reverse osmosis water system at your house, I recommend that. But then there's always pros and cons to everything. If you're going to do an RO system, which we have one here at the pharmacy and at my house, I'm taking a lot of minerals. I'm taking a lot of electrolytes because those RO systems pull everything out of the water, and that can be problematic too. So there's always pluses and minuses to everything that we do. So I think, for me, I want to kind of teach you the rules of the game, which is like, well, what do we need to do to detox? And why are all these toxins coming into our environment? And then how do we appropriately get them out? And that's where Brock's going to kind of go through, why Quicksilver system versus, we have all their systems. You said psyllium husk and chlorophyll and things like that. And bentonite clay and standard process. And we've done those, and those are all great. So tonight, the goal is to figure out, what's what technology delivery system does Quicksilver have that the other systems don't have, and maybe why that might help us get more toxins out of our liver and our kidneys and everywhere else they like to hide. So that's kind of the journey that we're going to be on. I'm going to skip through some of these slides, honestly. I just probably hit through all these learning objectives, so I'm not even going to talk about that. We already talked about how there's toxins everywhere, from the air that we breathe, the water that we're drinking, the food that we're eating. Even if it's organic, it still doesn't mean, yeah, there's no pesticides and herbicides sprayed on the soil, but, is that food even nutrient dense? Even though it's organic, doesn't mean that it's perfect either, so.
Not to mention U.S. regulations on glyphosate.
Oh yeah, which are horrible. Or atrazine. I mean, yeah. I mean, you can go a half a mile out of Brookfield here and dig up the soil, and I can't imagine how much glyphosate and atrazine is in that soil among everything else. So.
Was that a pesticide?
Pesticide, yeah. So sources of toxins are everywhere. The hard part, I think, for even most patients, I think that probably aren't here in this room right now, is realizing, like, well, I feel fine. I'm okay. I take my aspirin or my Tylenol or my Advil for my headache every morning when I get up, and I'm fine. All right. I have a handful of pharmaceuticals that keep my cholesterol in check, my blood pressure in check, whatever it is, asthma, arthritis, and I'm fine. My doctor says I'm fine. My labs say I do my blood work every year, and my labs are normal. But then you start looking at these symptoms, and you're like, well, I do have brain fog, I do have chronic fatigue, or I'm always tired. I need to drink caffeine every day, all day long. You start looking at that, and like, oh, maybe, and then you do a cleanse, and finally the fog lifts, and you're like, oh, I actually feel normal again. So sometimes we have to do. I didn't grab them tonight, but like a symptom checklist. I don't know if does Quicksilver have it? You do, yeah. Okay, I thought I came across that. So. I think Kelly got out every one of your emails. I can send you that list of just do an inventory check of how well are you sleeping, things to that nature, and then you can go, okay, that's your baseline, a very rough baseline. But then instead of spending thousands of dollars on testing, just do a symptom checklist, do a cleanse, and then repeat that checklist and see how your symptoms have improved. So it's an easy way to measure, if you needed to do a detox. There are some fancy, what do I have up here, like tumor necrosis factor, interleukin 1 and 6. There's these biomarkers that you can measure and spend a lot of money on and tracking these to see, get baseline levels of these inflammatory markers and see if they go down after a cleanse. If you really want to get nerdy and do all of that, you can. A lot of this isn't covered by insurance, so I'll tell you that. So it's and we all know, things that are healthy for you, typically, in my experience, they're just, good luck trying to get the insurance to cover that. It's a sick care system, not a wellness, optimal health care system. Heavy metal assessment, that is one thing that we do here. I don't have the pricing memorized off the top of my head. It isn't cheap. It's probably around $250. And it's very basic. It looks at mercury, lead, arsenic. There's a few other ones I'm missing in there, so it's not all comprehensive, but it is something that we do offer here. Fasting insulin levels, we talked about. A lot of people will want to do a detox or a cleanse to lose weight. I want to try to get away from that. Yes, this talk was advertised as weight loss, right? But in my mind, it's really, everyone, doesn't matter how much you weigh. Even if you're in a healthy, BMI, you should still be doing a detox cleanse, in my opinion, because those toxins, again, are everywhere. Fasting insulin levels, that's something that's often overlooked. If you are going to your doctor and you're doing just a general health check, they'll typically do a fasting glucose level, but I would encourage you to ask for the fasting insulin, because that's more, in my opinion, indicative of diabetes or insulin resistance, and then you can do something about it. Because once your glucose gets above that range where your doctor's going to actually mention something to you, in my opinion, it's too late. So it's we could have prevented that diabetic patient. I'll use my dad as an example, but who's diabetic. But in my mind, I knew all his doctor was doing was tracking his fasting glucose. And then once it got above 100, a couple times, then he was, labeled as diabetic. And the problem with that, in my opinion, and that's just one example, but there's thousands, millions of other patients, that if you would have looked at their insulin level and seen when that started to creep up, which was probably 10 years, 5 years before his sugar went up, you could have implemented some changes there and then to hopefully prevent the diabetes from even occurring in the first place. So people have told me, don't you mean fasting glucose, or is that a typo? And the answer is no, it should be a fasting insulin level. So, and then urinary estrogen metabolites. I just quick grabbed this kit before we just started tonight, but this is something that we've been working with Dr. David Zava and ZRT for longer than I've even been a pharmacist. So my father-in-law that started Yield Pharmacy back in '75, he started using ZRT and Dr. David Zava, I want to say in the early 90s, so probably 30 years or so. And and they started with just hormone testing, basically women's hormones and looking at breast cancer and things to that nature. And he's expanded his set of labs and testing that he's offered. And so they do a urine heavy metal test, and then they do a urine estrogen metabolites. We'll get in, there's a slide I have on that. Because when you start looking at hormones, there's a lot of estrogens out there, or basically chemicals that look like estrogen and they act like estrogen in the body, and we might not know if we have them or not. And then the other issue, especially for women, is that these estrogen-like compounds, they tend to accumulate in the body and in the fat, and then when we try to get rid of them, it can really disrupt our hormone scheme altogether, and it can end up with a lot of different problems. So it's nice to kind of do one of these. Again, if money wasn't an issue at all, you would do one of these urine metabolites and look at all of your estrogen metabolites and see where they're at, see if you have toxic estrogen in your body or the non-toxic. Do a cleanse, get your liver back up and running the way that it should, and then repeat that test is something that I'd recommend. Again, I think that estrogen metabolite test is around $300. So again, it's not a cheap date, but something to consider. Anyone in my mind that's got like breast cancer or family history of breast cancer, I'd be looking at where are my estrogen levels and what are those metabolites look like. So even men for prostate issues, in my opinion, they should be looking at that stuff. So. I'm going to quickly just go over, I got 3 main topics. So female sex hormones, obesity and the endocrine system, and then cognitive decline. There's a lot of information out there. We could spend 2 hours on the toxins in our environment and the negative impact they have on mental health. So there's a lot of correlation there. Female hormone disruption, so effects on toxins and estrogen hormones. So disrupted production and clearance can be affected if we have too many toxins in our system. Increased estrogen dominance or deficiency. So some of these toxins in our environment, they could bring up estrogens, but then at the same time, they can also bring them down. So it depends on the patient, depends on their liver function and things like that. There's a lot of other confounding factors that can play a role in that. So you can't always just guess and say that, oh, you're estrogen dominant. So a lot of times common symptoms of estrogen dominance, breast tenderness or water weight gain, inability to lose weight. That's a common symptoms of too much estrogen, but not always. So you got to look at that and actually measure that person's levels. I mentioned harmful estrogen metabolites. Examples of some of these disruptors, so bisphenol A. I've got a couple of slides coming up here that give you more detail. So like if you go home and you pause the video tonight, you can actually see there's a whole list coming up here of sources for BPA, commonly found in plastics, though. Phthalates that can be found in cosmetics. There's a whole list that's coming up here. PCBs, and then dioxins. So there's, if you look at the list, I'll just get to these, let me skip this slide. But here's the phthalates, they're all over. Personal care products, I would look at that. There's a website, I believe it's ewg.org, if I remember right, yep, okay. That you can like scan the barcode of a product, a healthcare product, and then find out basically what crap is in there that you should stay away from. So knowing's half the battle, in my opinion. So you think something is safe or healthy or organic or whatever, natural, and it may have.
It doesn't have a lot of organic. I mean, it does have organic stuff listed, but there's many products that they don't have that are really good.
Yeah. So you gotta, yeah.
So then you have to go through a process to try to
figure that out. Yeah.
To submit it, so they'll add it.
Oh, I got you. Yeah. Yep.
Mm-hmm.
So I'll skip through. I'm not going to read all this through, but just know that these phthalates are hormone disruptors, and they can really mess up, especially women, and their hormone balance altogether. So that's the majority of what we do at our pharmacy is helping women balance their hormones, even from just from a young age, all the way up through menopause and beyond. And so if a woman has a lot of toxicity and you don't know it, we could be it's like a moving target. We're trying to balance their hormones, and their hormones can be fluctuating month to month, year to year, and really the root cause of that hormone imbalance is that they have all these toxins that are just wreaking havoc on our endocrine system.
So just the on the food and beverage, dairy and meat,
Yeah.
is that from?
So usually it's because those toxins that animal ate, those toxins end up accumulating in the fat
So is that
of
more
that.
feedlot cattle?
That's
as
right.
opposed to
Yep.
grass-fed type?
Grass-fed, grass-finished. Yeah, yeah. So like, one of the recommendations is to trim all the fat off of something that would be like a non-organic piece of meat or dairy, something like that you could potentially separate out. So, but I'm all for organic, grass-fed, grass-finished beef, though. Honestly, if you can get it. So, but yeah, because the toxins in our body are going to hang out in our fat tissue. That's our buffer system of our body, and so yeah, they do hang out in the liver. But I think of the liver more as the processing center. But it's really the fat tissue that's the storage tank for all the toxins that we accumulate. So, and that's where Brock's system comes into play to pull all that crap out of our system. So, bisphenol A or BPA, and there's all these analogs now, like where the plastics and the flexible plastics was a big deal. There are so many of them all over a lot of the food and beverages. Again, this is not an all-inclusive list, but like the water bottles, all the plastic water bottles, never leave a water bottle in your car and it's going to heat up and then it cools down and then it just leached all that plastic and all that other crap in there, and then you definitely don't drink that water, please. So, the thermal paper receipts, ours are BPA free, by the way, for anyone watching. So, I still don't trust them though. I am always nervous about touching those darn things because they're shiny. Like, there's something on it, Yeah. Baby products, consumer electronics. I mean, everything, even this plastic. I mean, everything outgasses something. This plastic handle this clicker that I'm holding, probably absorbing something. The list goes on and on and on.
These pens
So,
that we're holding.
yeah.
Gotta stop thinking.
Yeah. The vinyl fake leather seats that we're sitting on.
The glasses that we're
Yeah,
on
yeah.
our face.
It just never stops. So, yeah. Pesticides are everywhere. I always say go to that EWG site. There's the Dirty Dozen and the Clean 15. I forgot what those are now, but yeah, if you're eating foods off of the fruits and vegetables off of that Dirty Dozen, ideally those are the ones. I mean, we all have limited income, so at least most of us do. I do. So if you are eating fruits and vegetables, what you want to do, go to that Dirty Dozen list and try to get those at least organic. So. Lawn and garden issues like the pesticides, the weed killers, all of those things. I had somebody come over to my house last year and they wanted to spray my house for spiders. I'm like, let's leave the spiders alone. It's fine. Yeah, they're not hurting anybody. And if they get into my house, I'll take them outside. It's fine. I can't say enough about the drinking water, like with all the agriculture in Wisconsin. The pesticides, the atrazine, there's so much material in our water that we don't want to drink.
Even well water.
Well, potentially, yeah, unless you have it tested.
Yeah.
Not that the system that we use at home, it's called Aquasana. It's a company out of Texas, I believe. But it's a simple system you can hook up right underneath your faucet in your kitchen, and you have RO water. So a very simple system. Yeah,
More and more states are
getting rid of fluoride. Yeah,
someday.
hopefully. So,
Most of it
yeah.
comes from China, so.
Anticipated cost.
This was a study that I just Epoch Times sent me last week, which I found was very timely as I was prepping for this talk tonight, about all of the flame retardants that are in the bedding and then your kids are breathing in this stuff. Pajamas, the stuffed animals, all this material either has material on it or it's basically outgassing these toxins that our kids are breathing in. So that's a problem, and then it really causes issues for their neurological development, their brain health. So it says flame retardants and phthalates have been linked to impaired memory, learning disorders, behavioral issues, and lower IQ scores. So if you just even Google search that University of Toronto study, you can pull it up and look at it. It's not great. So I actually took my son's, I don't know why, I don't know, took this, well, my son has like a little HEPA filter in his room because he has allergies, so when I read this the other day, I pulled it up and I put it, he's got a little table next to his bed, and I put the HEPA filter like right next to his face, and it runs all night now, so it's hopefully, he's like, Dad, why'd you put that up there?
No reason.
Oh my God, it's probably, yeah, it's just, I want you to breathe better. I don't know, I didn't get into the whole toxin thing with him, but
Too young for
he's
that.
9 years old, like, and then this whole weight toxin paradox. So what do we mean by this? Is like our body uses fat cells to store all these toxins, and if we don't have the metabolic capacity to get rid of these toxins, our body's not going to want to burn that fat cell off of our body, because then it's got to dump all those toxins into our bloodstream, and we're going to feel miserable. That's basically this paradox in a nutshell. Is that so we've got to figure out a better way to get our liver and our kidneys and our lungs functioning, so that when we want to lose weight, that those toxins that are going to come out with that triglyceride that we're using up as energy now, that toxin's got to go somewhere. Let's give it a new home, which is the liver, to get it out of the body completely. Water solubilize that toxin, because most toxins are fat soluble. That's why it likes to live in the fat. So our liver, it's one of its main jobs is to basically water solubilize those toxins. So it's called phase 1, phase 2 liver detoxification. If we don't have those pathways ramped up, that's why it's really hard to lose those last 5 or 10 pounds of weight or 15 pounds, is because your body has concentrated all those toxins into those last X amount of pounds, and it really doesn't want to get rid of them, and then you feel really, really crummy. So if that's you, if you're just constantly struggling to lose weight or constantly struggling to lose 5 or 10 pounds, I would recommend a cleanse. Something
So your body does that as a
protection mechanism, exactly.
Stuff would be floating around.
Yep, that's exactly it. So, yep. Toxins, and how am I doing on time? I feel like I'm...
It's 53.
Okay. I'll get like 10 more minutes. Okay. Toxins and this metabolic disruption. So something like, there are so many a lot of the toxins that are out there disrupt our endocrine system, which means it disrupts our hormones in our body. So if anyone has a hormone imbalance, not enough testosterone, for women it's usually not enough estrogen, not enough progesterone, we have been focusing here at this pharmacy mainly on, let's just measure your hormones and give you more hormones. But what I want to start doing is, okay, yes, let's balance your hormones, but let's assess the toxicity in your body, I shouldn't say first, but in addition to measuring your hormones. Let's basically measure those toxins if we can in a simple way by just doing that survey, that checklist. And then if you mark high on that symptom checklist, let's also do a cleanse while we start your hormone therapy. I think that's a better way to approach this whole hormone disruption issue. So, and in my research, there's this whole new term called obesogens. It's just a new term that research has basically come up with, saying that there's this class of chemicals. Some of them are endocrine disrupting, some aren't, but there's these chemicals out there now that are just causing disruption in our physiology, that's causing our bodies to either gain weight or inability to lose weight. So it can just cause us to just hold on to fat and not burn fat, or it can just slow down our metabolism altogether so that we just can't burn calories the way that we normally should. So the three things here that I kind of summarize: obesogens are these chemicals, these toxins they can increase the number of adipocytes, so they can increase the number of fat cells that our body is carrying around. They can promote fat storage into current fat cells. You can see these, I have this on a video that I posted last night on YouTube, where these fat cells are just growing in size and getting bigger and bigger and bigger, just throwing more triglycerides basically inside of them. And then it can also produce dysregulated fat cells, meaning that those fat cells are really part of our endocrine system. They produce hormones. Fat cells can actually produce estrogen, so they actually can produce more hormones for our body inappropriately. And it can be a vicious cycle where you can get these fat cells that are basically, instead of your ovaries producing estrogen or your testes producing estrogen, or your adrenal glands producing those hormones, your fat cells can actually produce estrogen, again, inappropriately. And these chemicals can basically hijack those fat cells and essentially have them do things that they shouldn't be doing. So And here's a list of them. We talked about some of them already, but these phthalates, BPA, bisphenol A, parabens, flame retardants, we talked about that just a moment ago, pesticides, probably even herbicides, but acrylamide. So people that are eating a lot of fried food, baked food. I don't think baked and roasted were as bad, but it was on the list. I would pick more like food that's grilled or fried. It's going to have more acrylamide. And then food additives, polysorbate 80, carboxymethylcellulose, MSG. I mean, look at all of the chips out there. As I was preparing for this, we were eating Pringles. They have a new Miller Lite flavor. Did you see this? The Miller, it was like Miller Lite beer chicken. Yeah,
Way.
I'm not kidding. They taste horrible. No, it's awful. So sorry, Pringles. But it is, like one of the ingredients, I was like, what's in here? MSG, monosodium glutamate. They weren't even good. I would stick with the sour cream and chive ones. Chase it with Miller. like only in Wisconsin.
Exactly.
So anyways, yeah. And then there was a lot of studies, but one here that I picked out of slowing down your metabolism. This was a randomized controlled trial of a little over 600 patients followed for over 2 years. They looked at baseline markers like your resting metabolic rate, the glucose levels, lipids, thyroid, leptin levels. Basically, the patients that had a higher baseline of toxins at the beginning, before the cleanse, they had a harder time losing weight. So we try to get these toxins out of our system, we're going to have a better chance losing weight. So that's what that slide's about. And then we can spend a whole hour talking about toxins and cognitive disruption. Going back to that article that came out on Epoch Times with the kids was just horrendous. If you read the whole thing, you're like, oh my gosh, just have my kids sleep on organic cotton mattresses. But that's not what they're sleeping on, but they should be. And then even for adults, so like we think of patients in nursing homes that, the cognitive decline and so forth. Oh, they're just getting old. Grandma's just getting old, whatever. Mom and dad are just getting old. And they're losing their memory and things like that. Oh, it's just because of their age. Well, maybe it's because they've just been accumulating toxins their entire life. It's messing up their cognitive function. So some of these things that we should probably be looking closer at. So, and then there was a study that looked at that. So it talks about the proposed mechanism. This was on lead. In cognitive decline is believed to raise oxidative stress. Lead can possibly increase neural cell death and disrupt neurotransmitter release. So some of these mental health issues that I think we're dealing with, especially in the elderly population, we're always trying to throw a drug at it. And let's do a baseline assessment of what's going on in this patient first before we start throwing medication at it and trying to just pushing on one or two levers with one specific pharmaceutical. That drives me nuts now. It just does not make any sense to me anymore. So. Not that I'm against all medications, but maybe that's the last ditch effort, not the first thing to try, right? So, and then mercury so lead and mercury are obviously very disruptive all over the whole system, but it can convert to this divalent mercury ion leading to binding proteins, resulting in improper protein structure and function. So mercury can just really muck up a lot of things neurologically. So that's one thing I'd be looking at. If there's anyone that's got any kind of cognitive issues, Alzheimer's, Parkinson's, I'd be doing a heavy metal test to see what their heavy metal levels are looking like. Because if they're elevated, then then we know, and then we can do something about it. So I know Quicksilver's got a whole kit for heavy metal detox. So, yeah. And those are my references there. You can't read them, but that's fine. And I'm gonna.
Perfect.
Yeah.
Well, I'm the opposite of you, Dan.
I know.
I sit all day, so I'm going to stand
Okay,
now.
there you go.
So I hope that's okay for everyone. I hope it doesn't make you feel too, weird or anything.
Yeah.
But
Yeah.
being a sales rep, obviously I'm sitting in the car all day, so I got to
Move around, yeah.
So, but thank you all for coming. My name's Brock. So I am the rep with Quicksilver Scientific. So we specialize in detox. The word Quicksilver is another word for mercury. So that's how we got our start, is through mercury detox. And our founder and CEO, when he was in grad school, he had experienced symptoms of mercury toxicity. He had amalgams in his mouth. He grew up in Pennsylvania near the steel mills, so he was just around metals very frequently. And in grad school, he started experiencing symptoms of mercury toxicity, brain fog, fatigue, low back pain, all kinds of symptoms. But the issue at the time, there was really no available for mercury, and also super perfected detoxes for that as well.
I forgot to give you your mic.
Oh, I I'm usually pretty loud by nature, but I guess for the online.
For the
yeah.
online folks.
Well, maybe you're not talking now, so maybe they wouldn't have complained. But so where was I? So with mercury. So basically, then he figured out he had elevated mercury, and he set out to basically perfect a detox protocol to remove it from himself. But then also, obviously, now we have protocols and products to address mercury toxicity, other heavy metals, mold toxicity, environmental toxins, fatty liver, GI issues, parasites, pretty much anything you want to remove from your bodies. We would have products to do that. And so obviously there's a lot of supplements in here, and I'm sure you all are taking some supplements, I'm sure, because if you're here today, you have some interest in that. And obviously most supplements are typically capsules or powders. Something that we do that's a little bit different, it's called liposomal delivery. Have any of you heard of that term before? Perfect. So I'll go through the details of that, the benefits of that, and really what a quality liposome looks like, because just like, supplements in general, the supplements here are much different than what you're going to get at Walgreens or at GNC. Obviously, what they have here are all professional grade, high quality as far as the raw materials are concerned, make sure there's no additives in there, all of that. Very similar with liposomal delivery. There's an array of quality that goes with it as well. So, like I had mentioned, we specialize in detox, and what our system is called is push-catch. And it's pretty simple. It makes a lot of sense. Certain products push toxins out of our cells, and then we have a binder that catches those toxins in our GI tract and safely removes them from the body. And having that two-step approach is important for an effective detox, which I'll get into in a little bit here as well. So first off, just going through the delivery, because it's really why our protocols work so effectively from a detox standpoint. So the issue with supplements in general is certain things just don't absorb well through our GI tract. Obviously, anything that's capsule or powder, you got to swallow. And our GI tract's the harshest environment in our body. Obviously, it's very acidic. And with the toxins, the bad foods we eat, the certain things we drink, many people in America especially, but also in Wisconsin, just don't have healthy GI tracts. And whether you have inflammation, whether you have dysbiosis, whether you have some permeability, any type of overgrowth, if you've been on antibiotics, all these things can affect the health of your GI tract, which in turn affects how much of a supplement you're absorbing. So with our delivery then, what it does is it's a liquid that's sublingual, and basically with our delivery, we completely bypass the GI tract. So you could have anything going on with your gut, and with our delivery, it's bypassing it, so you're getting adequate absorption regardless. Whereas with a traditional capsule, if you have two people, one that has a very healthy gut, one that has an unhealthy gut, the person with the healthier GI tract is going to absorb much more of that compound than the person with an unhealthy gut will. And obviously, if we're spending the money on these supplements, we want to make sure they're getting into our bloodstream, into our cells, where they're actually doing something for us, that we're not just paying for an expensive, bathroom visit if they're just going, out our stool and or our urine. So that's what our delivery does, is increase the absorption or bioavailability of these compounds so they can get into our bloodstream, get into our cells, and effectively do what they're supposed to do in our bodies. So first, you just got to go into what a liposome is. So a liposome, it's made of something called phosphatidylcholine, healthy fats, and it's basically a phospholipid bilayer, so this is what it looks like here. And if you would look at our cellular membranes, our cell membranes have that same structure in them. So basically the delivery is a sphere of lipids that then has a water-soluble core to carry the nutrients. So these liposomes are basically carriers, and since they mimic our cellular tissue structure, when you hold that liquid in your mouth for 30 to 90 seconds, they instantly absorb through your mucosal membranes, go to the lymphatics, and then disperse through the bloodstream. So by getting the absorption in the oral cavity with these liposomes, we completely bypass the GI tract, which again is what's causing absorption issues from a supplement standpoint. So that way you're getting adequate absorption every single dose, regardless of what you ate that beforehand, regardless of what the status of your GI tract is, etc. So again, this is what a liposome is. So to get into the detail a little bit, a liposome is a phospholipid bilayer with a water-soluble core. So that's where water-soluble nutrients are carried with. And for fat-soluble nutrients, it's something called an emulsion. Same delivery, it's just a phospholipid monolayer with a fat-soluble core. So that way the fat-soluble nutrients or vitamins can be carried with that. So with that being said, just so you understand how to utilize these, So how you use the products then is you pump the liquid in your mouth, you hold it for 30 to 90 seconds. And the reason you need to hold it is just to give these liposomes that are carrying the nutrients enough time to come in contact with your mucosal membranes. They permeate right through again, go to lymphatics, and then disperse to the bloodstream. So there's really 3 benefits with this delivery technology versus conventional capsules or powders. First one, we get an increase in absorption, anywhere from 5 to 25 times greater than that you would achieve with a capsule or powder. The second benefit, which in America here we usually really love, these are fast acting. They peak in 20 minutes in the blood, so that way you can get really fast results with that. This one in particular, it's our stress support product, and this is a really popular product for us. I'm sure you can guess why. If you start feeling anxious, you take a serving. 20 minutes is when it peaks in the blood, so most people are getting the calming effect within minutes of taking this product. Because again, it's peaking in 20 minutes, so you can get very fast results with that. And then the third benefit, which we've already alluded to, is we completely bypass the gut. So regardless of if your gut isn't healthy, regardless if you ate something you weren't supposed to eat before taking that supplement, because with other supplements as well, you have to eat or not eat depending on the compound you're taking. As an example, if you're all taking vitamin D, I'm sure you know you're supposed to eat a fatty food before you take your vitamin D to help increase the absorption of that. Since our delivery bypasses the gut, that's not something you have to think about prior to taking ours because, again, we're bypassing that system. So it's really a pharmaceutical-grade delivery technology that we implore into the nutritional space. So just to go through a few of the benefits of the delivery with you again. So this is an absorption trial that's looking at quercetin uptake. Quercetin, if you're not familiar, it's a very commonly used ingredient in the supplement space. It basically helps with histamine response or allergic responses. So this is our product for allergies then, or any type of detox reactions or mast cell activation, but for allergies in particular. So quercetin is known to have very poor absorption through the gut. So typically with quercetin supplements for allergies, you'll have to take a loading dose of it. So you have to take, 2 to 3 capsules multiple times a day for a week or so. And the reason you have to do that is just to get enough in the bloodstream to elicit benefit, because again, not too much of that compound is being absorbed through the GI. So with our delivery, we get a 25x increase in the bioavailability of quercetin. Other thing you'll notice is peak levels in 20 minutes. So what that allows for with our allergy product, HistaAid, is you don't have to take a loading dose, and you'll get relief again within minutes of taking it. Just like our GABA product, but except for seasonal allergies. Your allergies flare up. You take a serving of that within minutes, you're going to get relief from those. You don't have to wait a week for something to build up in order to get that relief, and you won't get the drowsiness or the other negative side effects that you typically would from, a Claritin, a Benadryl, etc. So another compound I'm sure you're familiar with, turmeric or curcumin in particular. That's another one that has very poor absorption through the gut. It's very beneficial, especially for inflammation and pain. But the issue with it, again, is it's so poorly absorbed through the gut. Typically, you have to take it for a week or two before you start to notice the benefits of it, because it takes a little bit to load up in the system. So this is another one we're getting in, again, 25 times more effectively. So that way you can use our anti-inflammatory products here, just like an ibuprofen, Advil, Tylenol, and you're going to get relief very quickly like you would with those, without the negative side effects that come with those different NSAIDs or anti-inflammatories. Just another one to relay the idea again, this is looking at CBD. We get a 6x increase in the bioavailability of that. Also, again, peak levels in 20 minutes. So obviously, if you're using CBD, it's for stress, sleep, or pain typically. Nobody who has stress problems, issues falling asleep, or pain wants to wait a week before they get relief from that. So obviously, that's beneficial in that realm. And then this one's just looking at NMN, which NAD, if you're not familiar with that, it's in our mitochondria. It's important for energy production. So this is just another compound that's used very frequently for basically increasing energy levels, helping with cognition, mood, as well as detoxing. Last one for you then. So this is our product AMPK Charge. It's like our natural GLP-1, which I'm sure we've heard a lot about at this point. Ozempic is a GLP-1. These are the weight loss peptides medications that are being utilized. So again, with our delivery, since we get these compounds absorbed more effectively, we can do really cool things with these supplements. And this one in particular, without eating keto, we're actually able to get you into nutritional ketosis within 30 minutes of taking it. So when you're in nutritional ketosis, now you're in a fat burning state. So that way you're using fat for energy rather than for glucose. And obviously then you're burning fat. But this is something that you can add in with our detoxes, especially if weight loss is one of the primary reasons that you are looking to do a detox. So let's get into the push catch then. So how do we do this? Why is it effective? How frequently should we do this, etc.? So one thing about our detox protocols, and I should ask before I go into this, I know I asked a few already, who here has done a detox before, by a show of hands? And how did you feel while you were doing that? Did you have a good outcome in the end, would you say? Did it affect your life quite a bit? You did? Oh, so it probably went pretty well for you. Tell everyone that. No. So, the term detox, it kind of has a negative connotation to it because it's like, oh, I'm going to have to drastically change my life. I'm not going to be able to eat or drink anything I like to be able to eat or drink. My whole day is going to be regimented out for when I got to take these products that are going to help me detox. Maybe I don't want to do that. Whereas with what we offer is we have a 2-step system, and it only takes about an hour of your day, 5 days a week. So we don't have to change up your lifestyle or drastically change how you're going about your day while still doing a very effective detox. Most of the time, I would say even more effective than what you'd be able to do with these other longer detoxes. So how it works is you take our liquid push products, or what's driving the toxins out of our cells. So in this case, that would be liver sauce. So you take a teaspoon of liver sauce, you hold it in your mouth for 30 to 90 seconds, because again, that allows those liposomes to be absorbed. Then you wait 30 minutes, you drink the binder. After that, you're good to go throughout the day. Ideally, if you're taking medications, you keep the medications 2 hours away from the binder. Food-wise, 30 minutes is usually all right, but if you want to be on the safe side with that, you can wait 2 hours as well. So if you are someone who is on a few different medications, you can dose this in the morning or the evening, whatever is more conducive for your lifestyle. But also, too, we're only dosing the products 5 days a week. So that goes for all of our products at Quicksilver. We only recommend to take them Monday through Friday. You can take Saturday, Sunday off. We get the nutrients absorbed so effectively we don't need to dose daily, but from a detox standpoint, the reason we do that is there's really 2 main things that downregulate our detox function and our liver capability. And that's inflammation and being in a sympathetic state or a very stressed state. So first with inflammation, well, let me back up. Those 2 days off then allow the body to rest, digest, and get lower inflammation, get back to that parasympathetic state so you can effectively detox week over week. So, why do we need a detox? Obviously, Dan went through a lot of why we do, but we have the organs to get rid of those, right? We have our liver, we have our gut, we have our kidneys, which are the organs that are primarily detoxing. But what happens is we produce toxins endogenously, of which our liver, kidneys, and gut take care of. But now in today's world, we just have so many toxins coming at us from the outside world that eventually our liver can't keep up. Eventually it passes that burden onto the kidneys, then they start to dysfunction. And over time, the liver can't process out as many toxins that are coming in, so it's pushing them back into our bloodstream, which is then causing damage, wherever those toxins go. Whether it's in our gut, it's causing damage and inflammation. If they're in our vessels, it's causing damage and inflammation. Wherever these toxins are, they're causing damage. And in the functional world, if you're looking for longevity, inflammation is really inflammaging. So whenever we talk about, like longevity and aging gracefully, the lower you can keep your inflammation, the better that's going to go. And by removing the toxins that are causing this damage, obviously that's going to help you do that. So
What is in the liver sauce and what is in the ultra?
Yeah.
What are they made of?
Yep, so liver sauce is actually supporting, so with detox, there's 3 phases of detox. So phase 1 and phase 2 are happening in our cells. Phase 3 then is really happening gallbladder, gut, until we remove them out of our bodies then. So one thing with detoxing and why it's important to have proper timing with everything is when in phase 2, you mobilize the toxins and convert them from a fat soluble to a water soluble state. So they're sequestered in our fat tissue because they're fat soluble, and our bodies then convert them to a water soluble form so we can actively remove them from the cell, accumulate in the gallbladder. The gallbladder dumps the bile that contains the toxins into the GI, and then you should remove them via your stool typically. So what happens then is when they are converted to that water-soluble form, they're actually more toxic than they were when they were sequestered in your fat tissue. So over time, when your liver starts dysfunctioning and starts pushing toxins back into the bloodstream, now they're in a water-soluble form that's actually more toxic or more damaging than they were when they were sequestered in your fat tissue. So I'll get back to the question. I'm working to it there. So liver sauce is working phase 1, 2, and 3. So the phase 1 and 2 portion, so it has something in it called R-lipoic acid. So that's stimulating our phase 1, phase 2 cellular detox pathways. We have 3 pumps of our bitter X solution over there, which we had talked about. So bitters, we have bitter receptors all over our bodies. It stimulates bile flow. So that's the phase 3 portion of liver sauce. It also then has some ingredients in there to calm down any histamine responses that could occur from mobilizing these toxins. So it has something in there called quercetin and luteolin, which we talked about already. And then there's also something in there called DIM. DIM is very important for estrogen metabolism, so especially for women. Basically, it ensures there's 3 pathways estrogen gets processed out of your liver. It's 2-hydroxy, 4-hydroxy, 16-hydroxy. Not that that matters, but the DIM ensures you process the estrogen out correctly so it doesn't lead to fat, adipose tissue, and or cancer causing. So with that being said, the reason these work so well is when you take liver sauce, we know within 20 minutes of taking it, every single compound in liver sauce is peaked in the blood. And so by the time then we take our binder 30 minutes later, we know that we've given those ingredients enough time to perform their action, drive toxins out of the cells, they accumulate in the gallbladder dumps the bile into our GI, and then the binder's there to catch it like a catcher. And the reason that the binding portion is very important for detox is there's something that our bodies do called enterohepatic reabsorption, which what that means is basically in our intestines, 95% of our bile gets reabsorbed and cycles back to the liver. Because if we had to just produce new bile 24/7, it'd be very energy intensive and not very effective overall. So we absorb 95% of that bile to reuse it. And with that, 95% of those toxins that are in the bile get reabsorbed and cycle back to the liver as well, which we just talked about. Now they're in a more toxic state than they were when they're in their fat tissue. So many of the times if you don't have a binder to neutralize those toxins and remove them via your stool, many of these toxins just are in a perpetual cycle of going from your liver to your gut to your blood, liver to your gut to your blood, and it just keeps like going through a revolving door like that until you add the binder, which binds them up safely, neutralizes them, and then you do remove them via your stool. So what's an ultra binder then? Activated charcoal, so that's a very broad spectrum binder, endotoxin, heavy metals, mycotoxins, etc. It's got zeolite in there. Zeolite's known for being a mycotoxin or a mold binder, which being in Wisconsin, there is a lot of mold in Wisconsin just with how moist everything is, how humid everything is, etc. We have bentonite clay in there, which is a environmental toxin binder. Glyphosate is one of the things that has affinity towards as well. We have something in there called chitosan, something called IMD, which stands for intestinal metals detox. It's got very high affinity for heavy metals. So that's our heavy metal binder. So basically Ultra Binder has different binding ingredients that are able to bind up whatever toxin your cells, your liver push out into the GI tract.
Hypothetically, say you forget to set your timer for 30
Yep.
minutes and you miss it. How long is it not effective to take the binder anymore?
So it's still effective. So I would just take it as soon as you remember. And so the thing is, our GI tract, it's just one long tube. It moves in one direction. So, you can take the binder, you can benefit from a binder whenever you take it throughout the day because any toxins you currently have in your GI, the binder will bind that up. But, again, our GI tract's one long tube. So the whole purpose to this protocol is since we know when liver sauce peaks in the blood, we're able to take the binder at a precise enough time so it's in the correct position so that way we're binding up the toxins that were driven out from that specific push phase. Whereas if you take the binder and the binder's way down here in your GI tract and the bile gets dumped up here, the binder isn't going to go backwards and bind that up. It's just going to keep moving through your GI, removed via your stool, and then obviously the toxins that were behind it are going to cycle back to the liver. So to answer your question, as quickly as you can remember it, obviously ideally you wait around that 30-minute range, but taking the binder is better than not. So
even if it's an hour later,
Yep.
It's not a big deal.
Nope, it's not going to totally, you're not going to totally ruin the detox from doing that, no.
You need the dose of the liver sauce.
Not at all.
Okay.
Not at all. Just the precise, like if you want to be really precise, the 30 minutes is what we recommend. So just to go over a study we did on the push catch. So this is our patented detox protocol like I had mentioned. Actually, one more thing I want to touch on is why the delivery is beneficial for detoxing is, so the ingredients I just listed off in liver sauce. If you had a traditional powdered capsule of that, you could swallow those capsules and let's say you took your binder 2 hours later. The thing about a capsuled supplement is each ingredient that's in these capsules takes a differing amount of time to peak in the blood. An example, quercetin, which we talked about, that ingredient takes about 4 to 6 hours to peak in the blood. There's other ingredients that are utilized that take 6 to 10 hours to peak in the blood. So with these nutraceuticals, they're really just stimulating pathways in our bodies that basically accelerate us to detox or push us to detox. So when they're peaking at different points throughout the day, how do you know when to take the binder? Because again, if you're not binding up those toxins from that push phase, you'll bind up what's there, but then whatever gets pushed out is going to cycle back to the liver, where then, when you hear detox reactions, people are having detox reactions, it's usually from doing an improper detox, because you're not safely binding up and removing those toxins in the GI. They're cycling back to the liver. You're putting more into the bloodstream than you're removing, which then causes all of the headaches, the redness of skin, all of those different things from not being able to remove the toxins effectively and having them circulating. So this is a study we did on the push catch. It was done on 103 patients with non-alcoholic fatty liver disease. And with these patients, we did an ultrasound and an enzyme test before and after to test severity and improvement. We put them on the push catch at our level 1 intensity, which is the once-a-day dosing that we were talking about. And they were on the kit for 1 to 2 months, depending on their severity. So in that time frame, 82% of the patients who did the push catch saw improvement in their liver tissue. 75% of those patients saw improvement in bile flow. And 12 of them actually had gallstones. 3 saw complete resolution of those gallstones, and the other 9 saw reduction in size. And that was only in 1 to 2 months of doing our most basic liver cleanse at its level 1 intensity level. We do have much more comprehensive protocols that you can do as well, but just for a general reset or for a protocol just to do, once, twice, 3, 4 times a year, depending what you're looking for, just to help optimize everything, that's a perfect kit for that. If you're looking to detox out something specific, like say mercury, like say lead, we'd have some other things that we'd likely add in for you there.
That was the once a day or the 3 times a day?
This is the once a day.
Okay.
Yep, this was for the once a day. Fun fact for you here, the largest stone in this study was 1.73 centimeters, and after the 2 months it went down to 1.14. So significant reduction in that time frame. So, with that being said, detox, think of it more as an optimization of your liver, of your gut, of your kidneys, and of your cells. Because again, if those organs aren't working properly, you're not removing all these things that are causing damage systemically. Also too, like Dan talked about with hormone disruption, many of these toxins bind to the same receptor sites on our cells that hormones do. So now you could have all of the hormones you want, but if your cells can't properly, if the hormone can't bind to that receptor site and be utilized by your cell, it's not going to do much for you anyway. So you need to remove the toxins that are bound to these receptor sites, remove the toxins that are causing damage to your cells, causing damage to your gut, to your cardiovascular system, etc. And there's a lot of different positive outcomes that you're going to see from that, from increase in cognitive performance, energy levels, GI health is a big thing you'll notice as well, along with many other things that you could experience there. I mean, we have various case studies with our protocols looking at cholesterol levels, which you may not think about a detox affecting cholesterol levels, but most of cholesterol metabolism is happening within your liver. We're able to get, in some instances, stronger reduction than you'd be able to with certain medications in a allotted time frame. We've had brain speed analysis where people have doubled their brain speed in a couple months of doing these kits, and even hormone levels without adding exogenous hormones. We've seen hormone levels come back within range for somebody who virtually had no hormones. They do a thorough detox and boom, their body's able to rebound because now all these different things that are causing issues aren't there anymore.
So just a question, why would, if you are binding those toxins, why wouldn't you have almost like 100% improvement? Like what cases occur where you don't get improvement?
Don't get improvement? Well, I mean, it's dependent on, how toxic they are. How many different toxins do they have in there? How sluggish is their liver? Do they have any bile flow at all that's going on? Because if you progress too long where your liver just really isn't functioning at all, it's going to take a lot longer to improve that. So
Or if you're missing the gallbladder.
That might do it too, yeah.
so yeah, it's usually from.
Patients that don't have gallbladders. It's amazing.
And you can still do the protocol if you don't. So I should probably preface that as well. But it's just dependent on the person, what they have going on. I mean, the more water you drink, the cleaner you eat, the better it's going to perform as well. Because again, you're mobilizing these to a water-soluble form, so the more water you drink, you're going to be able to excrete out some of those toxins as well. So if you do this and you would get a headache, Drink more water, because again, you're mobilizing these toxins. Now they're going to be more toxic than they were before, so that can cause, headache, redness of skin potentially. It is rare, especially with this protocol, because of how it's timed up with our delivery. But those are just some things to be cognizant of while you're detoxing. So, possible add-ons. What's nice about the push-catch system as well is if we wanted to make it more comprehensive for anything specific, all you do is take the liquid products with liver sauce, wait 30 minutes, and then take the binder. So we talked about AMPK charge being our natural GLP-1. Again, if you're looking to detox for weight loss purposes and you wanted to add in AMPK charge, how the protocol would look is you take 1 teaspoon of liver sauce, hold it in your mouth for 30 to 60 seconds, 1 teaspoon of AMPK charge, hold in your mouth for 30 to 60 seconds. You can mix both of those together and take them at the same time, but basically hold both of those in your mouth 30 to 60 seconds, wait 30 minutes, and then take the binder. Or if you wanted to add something called glutathione, which is our body's master antioxidant, master detoxifier, most of it's in our liver. If you wanted to add that to the protocol, basically you take 2 pumps of that with liver sauce, wait 30 minutes, and then take the binder. So whatever you want to add to the protocol, really the liquid products you just take with liver sauce, the binding products you take with Ultra Binder, so that way you can do whatever you would like to from a detox standpoint. So if energy is a main concern for you, you could add NAD Platinum in with liver sauce, wait 30 minutes, take the binder. So that's all I had for you guys today. If you have any questions for me, I am all ears.
Not that the binder is unpleasant in
Yeah.
any way, but I know you have the capsules
Yep.
too. Is there any clinical difference between the stick pack in the water and the capsule?
So they're very similar overall. So you're not going to see any crazy difference between them in results. The main difference is the capsuled form will have 1.8 grams of binding ingredients per serving. So you had asked about the binding portion too. So with binders, they all reach a saturation point. So they can only bind up so many toxins before they're completely full, cannot bind up anymore. So the more binding ingredients you have per serving, in turn, the more toxins you're able to bind per serving. There's a caveat to that, because if you take too much binders, you're not going to be able to remove anything via your stool because you're going to be constipated. But so the capsule is 1.8 grams of binding ingredients, less prebiotic fiber. The powder has 2 grams of binding ingredients with 2 grams of acacia gum, which is a prebiotic fiber. So you're getting more of the prebiotic gut benefits with the powder versus the capsules. But that's really not too much difference in the quantity of binding agents.
How long do you take this? Is it,
Yeah, this kit is 1 month if you're doing the once a day dosing.
Okay.
So
And what's recommended?
I would do
Depends on your body.
you'd want to start with the once a day dosing, especially if you haven't done a Quicksilver detox before.
Right.
These are true medical grade detoxes because we are driving these toxins out of the cells, and with our delivery it's really working at the cellular level. And I didn't go through it all the way, but how the delivery works is these liposomes, they permeate through your mucosas, they get to your blood vessels, they're going through your blood vessels until they encounter a cell. The cell membrane and the liposomal membrane merge, and it deposits the nutrients directly into the cell. So it's really depositing these nutrients at the cellular level, which then stimulates, this toxin release.
So does it get into your fat cells as well?
The
to remove toxins from there? Is
no, I would say likely not. I mean, maybe. I mean, that's something I've never gotten asked before, believe it or not, so I'm actually not 100% sure on that. But it's more so stimulating our hepatocytes, our cells, to drive these toxins out of the fat tissue, because when they're in that fat soluble form, again, we don't want to remove them. So when you convert it to the water soluble form, then we're able to get it into the bloodstream, where then it can get to the gallbladder. Gallbladder dumps it in the GI, and the binder catches it.
And you're doing this in conjunction with the proper diet.
Yeah.
Not, like if you're not eating healthy, this is,
It's still going to do something.
you're right.
You
gotta be.
You're ideally you're eating clean.
Take sugar.
Right. Because again, so the things that are down-regulating our liver function,
Yeah.
inflammation. So if you're eating high inflammatory diet, that's going to down-regulate your detox capabilities as well. So if you want the most out of the detox, you're going to eat clean, you're going to drink water, do the necessary things, get as good a sleep as you can as well, to just increase the efficacy of it as much as you can. So yes, you do want to eat clean ideally.
How quick does this make you go? Right away? Yeah. Okay.
It's dependent on the person. So, with the bitters in there, bitters stimulate bile flow. Bile is a prophylactic. It keeps our GI moving. So for some people, that can, cause them to go to the restroom in close proximity, most people aren't gonna, you know, you don't need to worry about doing this and going to work like you're gonna, you know, have to run to the bathroom or anything like that.
So
Yeah.
you shouldn't take a fiber supplement while you're doing that either, right?
So ideally, for the hour you're doing this, just keep it as that only. Take your other supplements outside of that.
You can still take like Metafiber or
Yeah.
Metamucil after that?
So if I was gonna, you know, recommend the fiber, if you want to take it in close proximity, take it with the binder, or just take it, you know, in the evening or in the morning whenever you're not doing the protocol. Because there is some prebiotic fiber in there in the binder already. But you know, just to keep it how it's supposed to be, I would just take that either after at some point. Yeah.
Okay.
So you do this, you know, like once a year?
Well, do you want the, you know, Quicksilver answer, or do you want like the just being a normal person and understanding? So Quicksilver answer would be once a quarter. You know, twice a year would be excellent. If you're doing it once a year, you're already probably in the 95th percentile. But, you know, just thinking about, we kind of forget we live in a crazy high-paced world. Last summer, we were breathing in smoke all year from the Canadian wildfires. So we're just breathing in toxins 24/7. And even with all the farms, like even if you're eating food or you don't live right near the farm, there is runoff. You know, we get rain that washes all the pesticides and stuff, and then who knows where it goes from that point. There's estrogen in our water from all the different birth control medications as well, which, you know, as men, and then xenoestrogens too, it's plastics, it's all these different things that, again, act like estrogen in our body. So binds to the same receptor sites, our body thinks of it as estrogen. So, you know, we live in a very estrogenic world, so detoxing that out is obviously beneficial for us men, testosterone levels as well. And, yeah, I don't remember how I got off on that one. Right?
Boost testosterone?
Yeah,
Lower estrogen.
right.
Nobody's talking about that. It's all like, oh, testosterone.
Well, and even for women too, like, you know, PCOS is something that's very common these days. And again, a lot of times it's estrogen dominance. We just live in such an estrogenic world that our liver, our kidneys, they need a little bit more support to be able to keep up with the demand of toxins that are coming in so frequently with, you know, the world we live in here. So
So I have a question, like, you were taking bentonite clay for a while, and then I had read, like, you can overdo that. I mean, have you ever heard things like that?
no, you know, with binders, there's a misconception that it's going to cause nutrient depletion is usually the
Like
concern.
It's taking out good things too, maybe? or
So
something,
a
right?
binder isn't, it's a passive detox. What I mean by that is it's not actively pulling anything out of your tissues. It's just binding up what's localized in your gut. So if you take your supplements, your medication directly with the binder, will it bind up some of that? Likely, because the binder doesn't have a brain. It doesn't know what it's grabbing. It's like, oh, I have you know, affinity towards you, I'll grab you. So, you know, as long as you're keeping it away, it's like away from the binder, it's not really a concern. Again, moves in one direction, our GI tract. So as long as there's space between them, it's not going to cause any nutrient depletion there. So unless you're taking the binder every time you ate right with it and taking it with all your supplements right with it, then maybe it could cause nutrient depletion. But if you're separating those things from each other, not really a concern. And to be quite frank, there was a study that came out, I think it was like from 1970 until like 2010 or something. The food's 70% less nutrient dense than it used to be. So if I'm being honest, unless you're supplementing, there's not too much micronutrients to bind up anyway. So take it right with your food, you'll probably be fine. I'm just kidding. 30 minutes is what we'd recommend at least as a gap there.
So I know your liver does most of its work between 1 and 3 a.m. So is there a recommendation for, I like to do it in the morning, but is it better to do it to catch more toxins in the evening?
Nope, doesn't matter.
Versus the morning?
Whatever's more conducive for your lifestyle. So, you know, that's what these nutraceuticals are doing, are stimulating the pathways. You know, NRF2 is one, AMPK is one. There's these pathways that stimulate our cells to drive toxins out. So these nutraceuticals are doing that to basically kick our liver going. Then the bile dumps that into the GI, and the binder binds it up regardless of when you're, you know, doing it throughout the day. So if you're taking medication and it's tough to find, you know, a hour, 2 hour window that you need to be away from meds or food, if that's tough for you, then just dose it in the evening. If you're someone who likes to fast, then it's really easy to do in the morning. You can drink coffee with it, so there's one thing that is a common question. More than okay to drink coffee with this as well.
I was gonna ask. Yay me.
So is there a good test to detect the level or tell the level of toxins in your body?
Yeah, I mean, there are total tox panels. There's different heavy metal analysis. You know, if I'm being honest with you, if you can just assume that you have toxins circulating, and a lot of times these panels are very pricey. So you know, you can look and get this test to say, oh, I have all these things lit up red, but there's a high likelihood that you would anyway, so you could invest more into doing, the protocols. But if you wanted to, there's various different companies that have tox panels. We run metals analysis ourselves. But, from my time just working in this functional integrative world, a lot of the providers I work with run a ton of these panels, and they say all the time, 10, 15 years ago we'd run these, you might see 1 or 2 things lit up red, but nowadays when we run them, there's 12, 15, 20 things that are lit up red. So it's almost more uncommon to not have something elevated this day and age than it would be too. So you could just,
Save the money and just do
right. And even just something daily that can help with detox as well is just taking binder, because again, at least then you're binding up the toxins that are getting into your GI tract. And whether it's metals, whether it's bacterial, fungal issues that are going on, whether it's environmental, all these things are causing damage to your GI tract as well, which then is causing leaky gut issues. So just by binding up and removing these inflammatory triggers, you can reduce inflammation, help heal your gut lining, and stop them also from getting back into circulation, or help stop that.
I'm gonna ask.
That's
you a
okay.
question, and I apologize.
No, no apologies needed.
So, you need your elimination pathways working
Mhm.
before this, so I hear a lot of different things about how many times a day is considered normal,
Mhm.
and to maximize the effectivity of this. What is the recommendation from Quicksilver on
Like,
proper?
how frequently you need to be going?
Yeah, to be able to not reabsorb the toxins from the binder.
Like how frequently you need to be going to the restroom is what you're saying?
Yeah.
Yeah.
Is it once a day? Is it 3 times?
Well,
Is it after every major meal? Is
A lot of times what they'll say, what everyone will say is once for every time of the day you eat. So if you eat 3 meals a day, close to, but at least once a day is definitely, what you'd be looking for there. But Dan, what would you say to that?
Once a day.
Yeah.
I mean,
It-
yeah, I've also heard.
Yeah.
After each.
Yeah,
significant meal.
right. But yeah, definitely once a day. But enterohepatic reabsorption, that happens 4 to 14 times throughout the day. And that's why this works so effective, is it happens at varying points throughout the day. So it's like, well, when do I catch these toxins if they're being absorbed at constantly throughout the day? So that's where our delivery being very timed and us knowing exactly when things are peaking in the blood allow us to be very precise with when we take the binder to prevent that from occurring.
Okay, so if you would have a regular BM cycle,
Mhm.
would you recommend doing the push kits before your normal cycle or after your normal cycle?
Could you ask that again? I'm sorry.
So, say you go every day,
Mhm.
every morning or whatnot.
Yeah.
Is it better off to do the push catch an hour before you know that that's gonna happen, or after that's gonna happen?
That doesn't really matter, because once the binder binds these toxins up, now they're neutralized, and the binder's not letting go of that until you use the restroom. So it's not like if you don't go that they're going to then, get absorbed back. I mean, if you're constipated too long, obviously you don't want to lead to something like that. But within reason, if you're going daily, you're doing just fine there. And if you are concerned about that, we do have a product called magnesium hydroxide, which I believe is over there. So it's a form of magnesium that doesn't get absorbed systemically. The saying with magnesium is where magnesium goes, water flows. So the magnesium just stays in your GI, pulls water in, so that way you can go consistently. Otherwise, I mentioned the bitters are in there to stimulate bile flow, which keeps your GI tract moving, helps with digestion, helps you, frequently go as well. You can take additional bitters if you'd want to as well. So there's bitters over there. So when you take them again within 20 minutes, it's going to get that bile flow moving, which is going to help you digest proteins, fats, and also just keep that GI tract moving and keep away any overgrowth. Because one thing with all these different medications we utilize for acid reflux, other things, it raises your stomach pH, which our stomach, the pH is supposed to be around 1.5 to 2. If it gets above that, that allows our good bacteria to overgrow. So SIBO is something that's very common in today's age. And it stands for small intestinal bacterial overgrowth. It's our good bugs growing to where they're not supposed to be. And we don't really eat bitter foods anymore in society, which is what stimulates bile flow. And bile is our GI's internal cleaner. It's really our body's production of stomach acid. And since it's so acidic, it goes through the GI, and anything that's overgrowing, it's so acidic it'll kill it off. So that's a good way to help keep away any GI overgrowth as well. And as well as improve gallbladder function too.
Put those bitters in your cocktail.
You can, yeah.
Same thing.
Yeah.
Really?
Yep. So Dr. Shade,
For a friend.
This is Wisconsin.
Right.
Yeah.
Dr. Shade has a story he always talks about Angostura bitters. So But yeah, it's similar idea to that. So yeah, just drink an old fashioned every night, you're good.
All right.
Anything else for you all?
We are offering, well, the promo is to get your coupons, but if you would get 20% off of the kits.
Yeah, the kit I didn't even mention. It's $133 for the protocol. It is a full month with that as well. And again, you're only doing 5 days on, 2 days off. It really isn't a nuisance on your day at all. You know, I've done various different cleanses from others as well, and there isn't something, well, more effective, obviously. I'm a little bit biased there, but the science we have to back does really back it up. But more importantly, it's the easiest protocol I've ever done as well. From outside of that hour a day, you're pretty much free to do what you would like. Obviously, like you alluded to, obviously you want to still drink water, eat clean, but outside of that, your whole day isn't regimented out where you got to take this at this time, this at this time, this at that time. And before you know it, your whole day's gone and all you were doing was taking supplements all day. So
that's for a month, so
It
that's
is.
for one person?
Yep.
Okay.
Yep. And you know, you can't get them individually as well. The kit will come with a booklet that tells you how to dose it, so it'll show all the different intensity levels.